How do beta blocker dosages affect blood pressure control? Imagine your blood pressure as a balance scale. When it tips too high, your heart and blood vessels face extra stress. Now, beta blockers are like the gentle weight that helps bring that scale back to normal. They work by blocking adrenaline and noradrenaline, which are hormones that make your heart beat faster and your blood vessels tighten. When these hormones are blocked, your heart beats more slowly and your blood vessels relax. This reduces your blood pressure and makes your heart work less hard. But here is the interesting part. The amount of beta blocker you take does not always mean a bigger drop in blood pressure. For some medications like betaxolol, a dose of 5 milligrams per day can lower blood pressure quite a bit. Increasing the dose beyond that, up to 20 milligrams, may not lower blood pressure much more. In fact, the biggest effect happens at the lower doses. Higher doses might help lower pulse pressure, which is the difference between systolic and diastolic blood pressure, but they don't always make your blood pressure drop further. Different beta blockers have their own dosing rules. For example, metoprolol usually starts at 25 to 100 milligrams once a day. The maximum dose is often for 100 milligrams daily. Propranolol might start at 80 milligrams once a day, with typical maintenance doses between 120 and 160 milligrams. The maximum dose can go up to 640 milligrams daily. Doctors usually increase the dose every 2 weeks, depending on how your body responds and tolerates the medication. In real life, lower doses of beta blockers can be quite effective for controlling blood pressure. Increasing the dose doesn't always mean your blood pressure will go down more. This is because beta blockers also affect your heart rate and how much blood your heart pumps. Once these effects reach a certain point, adding more medication doesn't help much with blood pressure. Often, doctors combine beta blockers with other medicines like diuretics or calcium channel blockers. These drugs work differently and can help get your blood pressure under control more effectively. So, in managing hypertension, starting with a low dose of a beta blocker and adjusting carefully is key. Sometimes, combining medications is the best way to keep your blood pressure in a healthy range without risking side effects.